It's Robert again at robertgardnerwellness.com. I wanted to talk about trigger points for self-care and access trigger points that are easy on your own body, with your own hands, to be able to typically use digit pressure to be able to work on yourself. The first one we're going to cover today is subclavius. Subclavius I found recently on myself because I have a problem with my left shoulder. There's been an ongoing series of issues for years with the shoulder I've been working on. And sometimes the shoulder just rolls forward in comparison to my right. When I practice yoga, when I look at myself in the mirror, I just notice it. I always wonder what's going on with the tissue here, what's going on with the muscle. And I also, because of my job, have a very physically intense to my hands, my carpals, so I have to take extra care to work on this part of my body. What I'm going to show you with subclavius went a long way to helping what was going on with my shoulder, because my subclavius muscle had trigger points that were not released. And subclavius, where it connects, is along the sternum, just underneath the clavicle. Subclavius, below the clavicle. It attaches right near the sternum, and your clavicle, of course, is your collarbone. This guy that I'm moving around right here. Subclavius attaches near the sternum, just below the clavicle, and goes back down, and I believe attaches to the underside, and maybe posterior, to the clavicle itself, so deep down inside. When you have trigger points here, what it does is basically from your coracoid process, which is this bony protuberance here, over, that's the line that we're working. This muscle, right on the underside of the clavicle. When the muscle fibers run this way, muscles only do two things. They contract or they relax. If this muscle is inordinately tight, what does it do? It rolls the shoulder in and forward. It can lock the clavicle in place so that unlike this side where there's movement, this side's sort of locked down. It doesn't allow as much movement. It can begin to affect other structures on the same side, so it's important that you look at subclavius. When you're working on it yourself, you can start by manually feeling where is the clavicle. Your fingers are going to press underneath the clavicle, not on the bone, all soft tissue. And you're going to get close to the sternum, and you'll feel muscle. Even just this tiny bit of digit pressure, just a reinforced finger, I can start to feel a little bit down my arm. Trigger points will often have a referred pain pattern. So what I'm then going to do is I'm going to hold this and maintain some pressure. Intense is okay. Pain is not. Slowly then, sinking in, maybe moving laterally out to the side. I'm going to slowly still slide underneath the clavicle, just below it. I can change the angle of my pressure whichever way I want, so long as I'm not pressing on the clavicle itself. I'm not trying to hold the clavicle, pull it around. Then I'm going to gently move my arm around. I'm going to move the clavicle because I'm trying to find the muscles around it and press into subclavius. I can start to feel that more almost down to my thumb. And I'm going to keep going lateral to see what I feel. I hear a little bit of a tiny crackle as my clavicle moves around. Doing that and moving my shoulder, I just felt part of my upper back adjust. There was a tiny crack. And I'm still going to slide out and around. It takes finger strength, and of course I've developed some of that working as I have over the years. But people who are having problems with subclavius will often have rolled in shoulders, and they will also have elements of arm pain, maybe even down into their fingers. Runs all the way down. Subclavius is a good muscle to check on women. Women who have breast tissue are more likely to have what? They're more likely to have excess pressure, excess tissue pulling this down, forming that. And if those muscles are chronically shortened, it's easy to develop trigger points in the same muscle. So subclavius, you have one on either side. Quick review. attaches along the sternum, just underneath the clavicle, going up almost underneath the coracoid process, but attaching on the underside of the clavicle itself, of the collarbone. You have one on either side. Try working on both in sequence. You can use any pressure that you want. You may have to cut your fingernail short to be able to access it, but try it on your own. See if you notice any changes. For people, again, maybe smokers, women with breast tissue, a very large breast in particular, are going to have more issues with that area. So, trigger points for self-care, try that out on your own. I'll see you again soon on robertgardnerwellness.com.